Frazier, DDS, and then Dr. Robert Thomas, who claims to have climbed a mountain recently. We don't have any independent verification of that, but he says he climbed a mountain. But he is someone who has been a staunch supporter of the ministries and has traveled several times with us. Very outstanding doctor, very knowledgeable. Every time I'm around him, I learn something new. So very appreciative to have both of these outstanding people with us. So Dr. Frazier and Dr. Thomas, if you would, go right ahead.
Good afternoon, everyone.
Good afternoon.
Thanks, Dr. Thomas. I know you've listened to a lot of Zoom talks over the past year, but this time I invite you to tune out any distractions, lean in, and take a good listen, because I have some really, really good information and I don't want you to miss it. My name is Trudy Ann Fraser, and I was born in Marchtown, Jamaica, and I grew up in Stone Mountain, Georgia. I am a board certified pediatric dentist, and I practice in Smyrna, Georgia at a phenomenal dental practice called Pediatric Dentistry at Vinings, where we see kids ages 1 to 18. I'm also a guest lecturer at Meharry Medical College, where I graduated from dental school. Now, I want to tell you guys, I haven't always been the premier pediatric dentist that you see today. In fact, I remember in my late teen years, sitting in the dental chair while my dentist approached me with what seemed to be the longest needle in the world while I sat to fill my 8th cavity. Yes, I have 8 cavities. I have 8 fillings in my mouth. I remember feeling the guilt, the fear, and anxiety. Dr. Thomas, don't look like that. I remember the frustration of having to go through the same procedures over and over again, tirelessly. It was in that moment that I decided that I was sick of getting cavities. I was tired of getting what we in Jamaica called getting joked or stabbed with the needle. This moment started a process that was further solidified while I was in dental school and what I know to be true during my 8 years of current dental practice. What I know for sure is that treating cavities starts with our day-to-day decisions. Thank you for showing up today, because I'd like to share with you what I've learned to be the 3 pillars to living your best cavity-free lives. Now, let's play a little game. Type 1 in the chat if you're ready. Let me go to the chat. Let me see if you guys are ready. You ready to play? All right. I'm going to move my computer. 1. You guys are ready. All right. Thank you for your participation. So let me know if you can see. Let's see. You know what I'll do? I'm going to bring it up to the computer. So take a moment and lean in to the display of drinks that I have. I'm going to walk through it. So number 1 is Gatorade. I want you to take a mental note of the drinks that you consume at least 2 times per week. Number 1 is Gatorade. Number 2 is an energy drink. Number 3 is a Coca-Cola. Number 4 is fizzy water. It's the what do they call it? Mineral water, or I forgot what they call it, but it's like the water with the carbonation to it. Number 5 is a Hershey milkshake or Ensure. That's going to fall in that category with your Ensures. Number 6 is a cranberry juice cocktail. Number 7 is a Starbucks Frappuccino. Number 8, oh, good old coconut water. Number 9 is just regular water. And number 10 is almond milk. So you can put, it's actually unsweetened almond milk. You can put your soy milk, your pea milk, your oat milk, all the other nut milks in that category. So I'll go over the numbers again. You don't have to write it down because I'm going to bring it close again. Number one is your ginger ale. So, excuse me, Gatorade. So your sports drink. So Powerade, Gatorade, all those drinks. Number two is your energy drinks. Number three is Coca-Cola. We'll put all sodas in that category. Number three. Number four is your mineral water or your sparkling water. I think that's what some people call it, sparkling water. Number five, you have your Ensures, your Pediasures, your Hershey's milkshakes. Number six is your cranberry juice. Seven, your Starbucks drinks. Eight is coconut water. 9 is just plain water. And 10, once again, are your unsweetened oat drinks. I don't have an assistant. I'm my own assistant today, so bear with me. So what I'm gonna do, I'm gonna show you the different drinks. I'll bring it up to the screen so you guys can see me. And I want you to pick, I'm gonna give you choice A, choice B, and choice C. I want you to pick how much sugar you think is in each drink. Okay, I want you guys to type A, B, or C in the chat, okay? So all right. Cranberry and 6. So I picked number 1 and number 6. So I've got your Gatorade and your cranberry juice, right? Those are 2 drinks. I want you to think about how much sugar you think. I'm gonna hold up these bags that I created that has sugar in there. All right, so option A in your Gatorade, your cranberry juice is gonna be 2 tablespoons of sugar. Can you guys see the sugar? Which equals to 25 grams. That's how much 25 grams of sugar is. That's option A. Option B is gonna be 1 tablespoon of sugar, which equals to 11 grams approximately, right? And option C is gonna be a 1/4 cup, which is 50 grams of sugar, which is a little more than 2 tablespoons of honey. I'm gonna do it again. Option A, 25 grams. B, 1 tablespoon. And C, a 1/4 cup. Can you guys type your letters in the chat? How much sugar you think is in Gatorade and cranberry juice? A, B, or C? A, okay. I see you, Paulette. B, okay. All right. You can keep C, you can keep score. You can keep score in your mind. That's okay. Let's go to another category. We're gonna let's pick this milkshake and this Coca-Cola. I'm gonna give you guys just 2 options this time. You know what? I'm just gonna give you guys 2 options. So we have the milkshake and the Coke, a can of Coke. How many grams of sugar do you guys think are in your Ensures, your Pediasures, the things you guys feed the kids sometimes and the pediatricians say that they need to gain weight? A 1/4 cup, which is 50 grams, that's a lot of sugar. And this is added sugar, right? No nutritional benefit whatsoever. Or 3 tablespoons. I made it easy for you guys. Which one do you think, let's hold them to the side, is in your Coca-Cola or your Ensures? Option A or B? Type it in the chat. A. Okay, 50 grams. I see you, Rena. Okay, Delray. B. Okay. Keep that mental note. Let's go to our next category. All right. We'll talk about your energy drinks and your sparkling water and your energy drinks, right? I'll give you guys two options. 0 sugar and 0 acid, or 0 sugar and acid. A or B? 0 sugar and 0 acid, or 0 sugar and acid, and the acid is carbonic acid. I intentionally said acid. 0 sugar, 0 acid, or B. Okay, I see those answers. Good. All right, let's go to our next category. Let's talk about, you know what? We're going to divide these two categories. Let's talk about the Starbucks coffee by itself. So I use Starbucks coffee, but this is any sweetened coffee. This is non-black coffee. So, all right, so for the coffee, right, this is a 9.5 fluid ounce. Is it 3 tablespoons, which is 32 grams of sugar? Look how much sugar, this is added sugar. That means they did like this and poured it in. Or 1/4 cup, which is 50 grams. Which one do you think is in the coffee, A or B? 3 tablespoons, 32 grams, or 1/4 cup? A, okay, B. Okay, you guys are good guessers. I guess you have a 50% chance, right? All right. And now we'll talk about, okay. We'll talk about the coconut water by itself. We'll do, I'll make this one easy on you all. This is the coconut water. This one I got from the farmer's market. So it's gonna be a little different depending on where you get it from. But how much sugar do you think it's in that? 0 sugar and acid, or 1 tablespoonful of sugar, which is only 11 grams. That's in your coconut water. A, the tablespoon, 11 grams, or B, no sugar and acid. A, yes, Delray is A. All right, and then the last category, I'll make this one easy for you. It's regular water, and this is unsweetened nut milk. So that's the operative word, unsweetened nut milk. You have one choice, A, 0 sugar and 0 acid. Is it A or B? Good, everybody got that one. All right, so let's review what we just went through. I'll answer you guys' questions. So the first segment that we went through was cranberry juice and Gatorade. And actually that has 2 tablespoonfuls or 25 grams of sugar. Let me find that bag. Here we go. So in your cranberry juice and your Gatorade, the stuff that you think is healthy, you're still pouring quite a bit of sugar. And this is added sugar, no nutritional value. They just said, this is the drink, let me just dump that in there. Your milkshakes or your Coca-Colas, that has 1/4 cup or 50 grams of added sugar. So the Coca-Cola is all sodas, Sprite, your orange, your Fantas, that's this much sugar. They literally, I mean, this is so much sugar. I don't know about you, but I wouldn't just go like this, but that's what we're doing every day, that we consume just 1 can or just one bottle of that Ensure, you know. They use Ensure, they advertise it as a meal supplement, or the Pediasure for the kids as a meal supplement. But honestly, guys, it's really just sugar. In terms of, it says 0 sugar and some acid. So I have a lot of patients that they're like, oh, I can't drink regular water. So what they do, they'll get the mineral water or the sparkling water and they'll drink that. But what we're not taking into consideration is that this though it doesn't have sugar, it has carbonic acid. I think that's the first ingredient. I know some of them won't say carbonic acid, they'll say carbonated mineral water or carbonation, things like that. Acid does exactly what it says, burns holes. So the acid in this is actually burning holes in our teeth. And every time we pick this up and pour it into our mouth, we're burning holes into our teeth and weakening our teeth and making us more susceptible to cavities. That includes your energy drinks too. That has the carbonation in there. So the coconut water has just 1 tablespoonful. And I like to say this is the lesser of the evils. It does have some sugar, but you want to compare this to this. I mean, which one would you have? I would much rather the smaller amount. And your Starbucks coffee. I think, a lot of times we talk about caffeine giving you that high and waking you up, but it's actually sugar too that's doing that to you. The 32 grams of sugar, it may be less sugar than is in your Coca-Cola, or your other sodas. Maybe you don't drink Coke, maybe you drink other sodas, but it's still 32 grams, which is still this much. Like I said before, I wouldn't take this and just dump it into my mouth. Okay. So your best option, I would say, out of the 3 things would be your coconut water, your regular water, or your unsweetened milk. So if you want to do this throughout the day, then fine. But all the other stuff, I would limit it. I would limit to the ones that has less sugar. But 2, I would limit it to a meal. So I wouldn't just drink this. Every time you pick that up and drink it, you're exposing your mouth to acid, you're exposing your mouth to that sugar. And how cavities form is the drinks that we drink or the food that we eat breaks down, and the bacteria in our mouths, the bacteria in our mouth drinks that or eats it and produces more acid. And that acid burns holes in our teeth, and that's what we call a cavity. All right. Thank you for your participation, guys. All right. Okay. So I was discussing the 3 pillars of living your best cavity-free life. Pillar 1 is going to be select foods with low sugar content, limit foods with sticky substances like dried fruit, fruit snacks, and gummy vitamins for kids. Instead, eat whole fruits, nuts and grains, and hard chalky vitamins because those objects stick to the grooves of your teeth. So you want to choose the harder substances, not the sticky stuff that'll stick in your teeth. Limit sweet drinks, like I said earlier, to mealtime, and drink water all throughout the day. Water actually neutralizes the pH of your mouth, so it makes it less acidic, right? Pillar 2 is going to be floss first and then brush. Brushing with, I prefer, and a lot of dentists prefer, a fluoride toothpaste. At work, I always ask the kids when they bathe, do they wash their armpits? And most of the kids, except I've had a few teenage boys that will say yes. Some teenage boys have told me, no, they bathe and they don't wash their armpits. But I think most of us here, when we bathe, we wash our armpits. Well, I'm here to tell you that the armpits of our mouth is actually in between our teeth. So when you're brushing and you're not flossing, you're actually skipping your armpits. Is that gross? Yeah, I think that's pretty gross. At work, I recommend flossing first and then brushing. And that's a trick that I actually have developed, because if I don't floss first, I'll forget to do it after I brush. So I got to floss first so I can floss my armpit. Pillar 3 is going to be, if you have children, take them to the pediatric dentist by 6 months after their first tooth erupts, which is usually age 1. So that's the first visit by their first birthday. The way I explain it to our families at work is that kids have a pediatrician. In order to take care of their child-specific health care, they should also have a pediatric dentist for their child-specific dental care. Thank you guys for taking the time out to listening. I would say it was very informative. I would say the biggest thing for me today, pouring the sugar into these bags and envisioning myself actually drinking these really is a game changer. I went into my pantry and I started to look at all the things that have added sugar that has no nutritional value. And honestly, it's going to be a game changer for me. I'm really going to reduce the amount of sugar that I intake on a daily basis. I think all the other things I have down pat, but I'll be honest, I'm guilty of consuming too much sugar. If you guys have any questions, I think we're going to have a question and answer session. But if you guys have questions for me specifically that we weren't able to answer here, I'm available on Instagram. My Instagram account is tinytoothdocc. That's TINYTOOTHDOC. And I'm also on Facebook at TA Freeze. That's T Trudy and TA Freeze, FREEZE. That's what the kids at work call me, Dr. Freeze. Thank you guys for listening. From Dr. Freeze's heart to yours. And I look forward to hearing about your journeys to living your best cavity-free life.
Well, thank you, Dr. Freeze. Appreciate that. And thanks for the reminder to floss our armpits. That's a very good reminder. Thank you.
I knew you were going to say that, Marvin. I knew you were going to say that.
That was my favorite part of it.
I knew you would say that, Marvin.
All right, time for question and answer. By the way, Dr. Thomas, did you have anything additional you want to add before we went into the question and answer?
Yes, I have one pictorial that will help people, help our participants visualize what happens to a tooth. What makes a cavity, in other words. I get this question kind of often. Say, well, what is a cavity? Well, first you take the word cavity itself means a depression or a hole, HOLE. But I do have just a little slight video that you might be interested in. It kind of, well, Dr. Frazier segued directly into this information. For those of us who want to know, just scientifically what happens, she spoke about the acid production and the hole and exactly, what does that. So if I can indulge your attention for just a couple minutes, Grace, you want to let me share? Okay, let's.
Latin, caries means rotten or foulness. Caries is a tooth disease caused by bacteria. Our bodies are occupied by numerous bacteria.
Sorry.
In Latin, caries means rotten or foulness. Caries is a tooth disease caused by bacteria. Our bodies are occupied by numerous immediately after birth because of our parents and our environment. Not all bacteria are harmful. For example, the bacteria flora in our intestinal tract is crucial for our survival. This is called symbiotic bacteria. Other bacteria simply settle in niches. These are called commensal bacteria. We do not benefit from them directly. However, settlement of such niches by commensal bacteria, for example in the skin, prevents these areas from being inhabited by other harmful bacteria. Sometimes bacteria and hosts struggle in a fight for dominance. Doctors call such germs opportunists. If the host is damaged by bacterial dominance, meaning the bacteria is winning, these germs are then referred to as pathogens. We have a number of bacteria in our mouths. Some live in essential niches and prevent other aggressive germs from ever settling, while other bacteria simply live alongside us. This means that we have both symbiotic and commensal bacteria in our mouths. However, the bacteria flora can change instantly due to changes in life circumstances. Commensal bacteria can suddenly turn into pathogenic germs. This is what happens with caries. The most important factors are certain host factors, plaque, and time. Host factors encompass all the factors relating to the host, such as tooth anatomy, saliva composition, and cleaning habits. Plaque is a layer on the teeth consisting of saliva parts, bacteria, and carbohydrates, and forms when the teeth are not cleaned properly. When all these factors come together, bad cleaning habits, plaque, and time, they lead to the development of caries. We'll now use the animation to take a little tour into the plaque itself. Plaque is organized like a little city. There are bacteria that are specialized in just holding on to the teeth. Other bacteria transport nutrients by forming transport tubes. Then there's Streptococcus mutant bacteria, producing nutrients from organic acids, which in turn attack the tooth by removing existing minerals from the tooth substance. Working together, you can see that plaque is very much like a little city. The formation of mature plaque usually takes about 24 hours. That's the amount of time it takes originally commensal and symbiotic bacteria to turn into germs that are pathogenic. If unorganized, mouth bacteria is not harmful. Only mature plaque can cause caries and periodontitis. Therefore, it's very important for everyone to remove plaque efficiently with the help of a toothbrush, dental water jets, and floss. By doing so, the bacteria are deprived of their habitat. Without this habitat, they cannot cause any more harm. Within the plaque, the bacterial products disintegrate the enamel. However, as soon as caries reach the dentin, depicted in our video here in yellow, the dentin is settled by bacteria. This is because the dentin contains proteins that supply the bacteria with a constant and ready food source. Even when the plaque is removed thoroughly and conscientiously from this point, the caries cannot be stopped. They develop their own dynamic. You can find out more in the video entitled Initial Caries. Tooth usually occurs when caries have reached the tooth nerves, marked here in red. In this case, a root treatment is necessary because the nerve has been infected by bacteria. If the root treatment is done incorrectly, it can lead to bone inflammation.
All right. Can you hear me back? I stopped the video because that was the main point that I wanted to bring out, as Dr. Frazier so vividly did for us in terms of sugar content. So from this, we can understand that what happens with the sugar is that, does anyone remember what type of bacteria was on the tooth?
Streptococcus mutans.
That's correct, Doc. Streptococcus mutans has a unique ability of making acid from sugar. This is why sugar is so bad for you. And in particular, the polysaccharide type of sugar, which is your sucrose in particular. They love sucrose. That's it, the regular table sugar. But your mono or less saturated type of sugars, or less, they don't have multiple saccharide units
Less
to
complex.
them. Less complex, such as your fruit sugars. Although they can still cause caries, they won't do it to the extent that the polysaccharide and sucrose does. So I thought that was excellent that Dr. Frazier showed you. You can visualize. So there's so many foodstuffs out there that are really produced with sugar. And the food industries, of course, want to sell you things that have many, many sugars in them. So that's why we have to be vigilant, and we have to be very careful to remove those sugars. Now, what was the critical period of time? Once again, anyone have that answer? You could put it in chat if you want to, but how long does it take before you can start to get demineralization of the enamel? Does anyone remember that?
24
24
hours.
hours.
Very good. And is there a correlation to that 24-hour period and the formation of plaque? When does plaque start to form?
4
Anyone?
hours.
About 6 hours, about 6 to 8 hours. So you can see that if you, but the plaque doesn't mature at that point. It matures a little bit later, but it certainly forms much earlier, and it forms these, the little city on top of your tooth. It's invisible, but it's a very good home for the bacteria. They love to live there. They're locked in place by like a little gelatin mattress, if you will. So this is why mechanically dislodging the plaque is so very important. So I won't go on, but I guess you noticed we talked about cavities quite a bit. And there are other things that will cause, is everyone hearing me?
Yes.
Okay. There are other deleterious effects of the pathogens, the pathological bacteria, Streptococcus, along with some gram-negative bacteria that eventually get into your system. And someone had a question, I think, related to that, but I will let you guys ask your questions. Moderator, if you could let me know what the questions might be at this point.
Actually, Dr. Thomas, I do have something to say. One of the my pillars was actually not just taking the kids to the dentist as early as year one, but also as an adult, ensuring that we're going to the dentist every 6 months. And the reason for that, as you saw in Dr. Thomas's presentation, how fast the cavity moves. A cavity can actually be a very small cavity, but it doubles in size in 6 months. So if you go to the dentist every 6 months, you can potentially catch those cavities while they're small and get either a small surface filling, or there's actually, it's not new, but it's newly FDA approved in the past maybe 10 or 15 years. It's a material called silver diamine fluoride. It stands for SDF, and
Yes.
SDF is a super fluoride treatment that we actually can place on the tooth if the cavity is very, very tiny. And it has the potential of either slowing down the progression, how fast that cavity moves, or it can actually stop the progression. So if you go to the dentist every 6 months, you can actually catch those small cavities, and you may not even have to get a filling. And if you have to get a filling, which is not the end of the world, I'm okay. You'll prevent yourself from having to get a root canal therapy, which is when that cavity ends up in the nerve of the tooth. You can potentially prevent yourself from having to have pain. You can even prevent yourself from having to have a crown on that tooth because the cavity is so big. Or the worst case scenario, having an extraction or an infection. Those infections can spread to your heart, your brain, and just get worse. So that 6 month checkup is not just for us to smile and wave at you, but there's scientific proof that cavities progress or double in size in 6 months. So it's really prevention. And my mommy's on here. She says prevention is better than cure. So the prevention is super important.
Very, very good. In fact, Dr. Fraser mentioned the word exponential. And this means that it doesn't just spread in a linear fashion. It means that the decay divides and divides and divides, much like the COVID virus. one might infect 2 more or 3 more, but those 3 will continue to affect more and more. So the most destructive phase of this cavity production is when it penetrates the outer surface of the tooth, which is called the enamel, which was in red on the, I'm sorry, white on the pictorial. But once it gets into the softer layers, the next softest layer is the dentin, which composes the bulk of your tooth. Oh, it just takes off in the dentin. This is when you start to get the exponential spread. And this can happen in 6 months. It can happen in less. So you want to protect that delicate area on the inside, which is called the nerve, because it explodes when it gets to the nerve. So you can think of it in those terms. Okay, any questions from the moderator or from the audience?
We don't have any questions in chat, so I just want to.
I will say this, we touched maybe a little bit on periodontal disease, which is also caused by that bacteria, which is a normal part of our mouths, but for some reason it just, you know, it takes off in certain conditions, and those conditions are
Marvin, let him know that he's
flag.
dragging a little bit.
Yeah, I was wondering if that was mine. So got
good.
Dr. Freeze and Dr. Frozen.
Okay.
So
Is there a delay in my
Move his
is there a delay in my speech?
he's still talking.
I'm gonna call him.
okay, thank you.
Yeah.
Thank you, Dr. Freeze. Call Dr. Frozen.
So
Let him know.
I'll
we have
answer
Anyone
some-
still hear me?
No,
Yeah. No, you're frozen, Dr. Thomas, and you're dragging.
I thought it was my
Can
internet. My brother
everyone
texted
still
me.
hear me?
Yeah, I thought it was mine at first too.
My brother texted me. I thought it was
Yes.
mine.
Can you
But I-
still hear me?
Not well. Yeah.
Oh,
So Dr. Thomas, you may have to move to another.
so it's lagging. Okay. I'll have to get a faster.
Yeah, you're gonna have to spend some of that money you make and get
So
faster.
I do have a little lag in this machine.
Yes, you do.
Marvin, I have a question.
Okay, go right ahead.
I'm still frozen. I'm still. Oh. Oh my.
So we came up with a game plan. Dr. Thomas is gonna
Okay,
type
so
it.
that means. Am I still frozen?
Yeah, I think Dr. Thomas, you're gonna have to stop talking and let Trudy be your mouthpiece.
Pun intended.
Oh,
So
I
I'll
see.
answer the question on periodontal disease.
I'm right in the room with the CPU though, and I have no idea why it's that slow.
Yeah, well,
Yes, I'm on my laptop, so my desktop is very fast.
yeah, Doc, that's what happens when you use dial-up. So I think you're gonna have to.
I would have to set that up.
So I'll answer the question on periodontal disease.
Okay.
Periodontal
The
disease.
answers in chat. Okay.
So there are various
Okay.
there are various different types of bacteria in our bodies. There are tons of bacteria in our mouths. There's a couple, including what Dr. Thomas was referring to, that strep mutans
Okay.
that causes dental cavities. Well, there are other bacteria. They have
Well,
long, fancy names,
good
and I don't
mouth
have to bring it
is-
up here today. Can you hear me, Marvin? Okay. So there's some, Marvin, you're frozen. Are you at Dr. Thomas's house?
Okay. All right. It looks like I'm yellow now.
Oh,
Is
Lord.
everyone hearing?
Oh, goodness. Let me finish answering the perio question. So
No,
there's some
this-
other,
Dr. Thomas, if you could just pause for a moment, let Trudy finish her thought, because we didn't intend this to be a comedy show, folks, but it is kind of funny. But Trudy, if you go ahead, and Dr. Thomas, just wait for a little bit and let Trudy finish her thought, and then we'll try to bring you back.
awesome.
Go right ahead.
Such a good moderator.
no.
So there's a different type of bacteria. In fact, it's a group of them that cause what we call periodontal disease. And breaking down the word periodontal, perio means around and dental means tooth. So periodontal disease is when something around the tooth is affected, and that something is your gums. So the pink part,
Yes,
your gums
indeed.
are affected by this bacteria. So anytime you leave plaque in
Okay.
your teeth and you don't brush, the germs in the
Yes.
plaque start to produce toxins or different types of acids, different types of chemicals that the gums don't like. And it starts to break it down. And because the gums don't like it, they start to move down. And underneath the gums are the bones. And those toxins get in the bones and the bones move down. So when you have bone loss, we now classify it as periodontal disease. And it all starts from actually flossing and lack of flossing and lack of brushing. So it's different from the cavities process. But when you have periodontal disease, it's important to get a different type of cleaning, because it's no longer cleaning the outside where you can see. Now you're going around the tooth and underneath the gums into the bone. So you'll have to get a special type of cleaning from your dentist called a scaling and root planning, SRP, where they get deep down into those pockets that you now have because the bone and the gums are gone. And they try to clean that out and make sure you have a clean mouth so that the disease process doesn't progress. So the goal is to remove all the hard stuff that's down there, all the food that we weren't able to clean out with just a toothbrush, and really get in there and scale it and remove it so that the disease doesn't continue. Does that answer your question? I'm not sure who asked the question.
Mhm. Mhm. That was a
I think
very
Alan.
good answer.
Yeah. So, one of the things that my dentist tells me is that these things can affect not just your teeth, but if you're not careful, it can have other health effects. Can you share some of that with us as well?
Yes. Am I back now? Am I back now? Am I
Better.
back now?
Better.
Better?
You're better.
Awesome. Okay. Okay. How about that? Can you hear me now?
Yeah, that's good. That's good. Go ahead.
Okay. Okay. Yes. She was about to mention the bacteria can also cause endocarditis or heart problems. And actually, the various bacteria who have quite an array of various and sundry names that we will not go through at this point in time, but they are very virulent and they like to move throughout the body. At any given time, a number of us may have what's called bacteremia, but usually the bacteria from the mouth
Marvin, we're having the
can
same problem. One
become
moment, Dr.
worse
Thomas.
as our immune system kind of depletes, or if it reduces. So in particular, these bacteria, they invade the small blood vessels of the gums, and they travel through there to larger vessels and eventually to the heart valves. And we do know this.
Okay, Dr. Thomas, we're starting to lose you a little bit again. So we do have a couple of questions in the chat. Trudy, it looks like someone is very impressed with your smile, by the way. She said that that's great advertisement. So thank you for that. And that came from Carmen.
Thank you, Carmen, Charles.
Okay.
And Sister Narika Allen wants to know where you practice. And also for both of you,
Thank you.
Carmen and Charles actually say you
Mhm.
both look like you're happy doctors. So that's so nice. So very good. I have another question. What are the disadvantages of getting veneers?
Dr. Thomas, were you going to say something? I was going to give you the opportunity.
So very good. All right. So I think we've got a delay both in him hearing us and us hearing him. So Dr. Trudy, if you would go right ahead.
Okay. So let me answer the periodontal disease question first, Marvin.
Can you hear me?
No, we can't.
Can
So
you hear me?
No. So just wait and let
Anyone?
no.
Oh,
So Dr. Thomas, you may need to just use the chat feature when you're answering because there's a significant lag there. So Dr. Freeze, go right ahead if you would answer those questions.
Yeah, no problem. Well, thank you for the compliments, Carmen. I practice, Dr. Thomas can write in the chat where he practices, but I only see kids. I'm a pediatric dentist, and I practice at Pediatric Dentistry at Vinings. It's actually in Smyrna, to the west of Atlanta. The second question about periodontal disease. So anytime bad bacteria, you have good bacteria and bad bacteria. Anytime bad bacteria travels to a place, it produces a toxin and it could cause issues. So if the bad bacteria sits on your teeth, it produces an acid and burns holes in your teeth. The bad bacteria travels to your gums and it sits there and all the germs chalk up there and collect there, it causes periodontal disease. That same bad bacteria can travel into your bloodstream and end up in your heart. It can end up in your brain. If it ends up in your heart, I think Dr. Thomas was referring to endocarditis, it can cause issues there because it produces toxins. Any place that our bodies does not want bad bacteria, it disrupts what's called the flora, meaning the good bacteria, and wreaks the havoc. And anywhere it goes, it can cause an issue, and we would classify that issue that it could cause. That's part of the reason that dental care is so important. Washing your armpits, flossing, and brushing is very, very important because you reduce food for the bacteria to eat, but you also reduce that bacterial content in your teeth. In terms of the veneer question, so that's a case by case question. And I'll preface my statement by saying, talk to your dentist because everyone is different and it's hard for me to answer such a broad question without knowing exactly what's going on. Veneers, so they're different restorative procedures. So as a whole umbrella, anything that we do to fix something in dentistry is called a restorative procedure. You have smaller procedures like fillings. You have bigger procedures called crowns. That's where you put a cap on the tooth. It could be a front tooth or a back tooth. And you have in-between restorations or restorative procedures called veneers. So anytime you have to cap a tooth because whether it broke or you had to have root canal therapy, you're trying to restore the functionality of that tooth because who doesn't want to keep their teeth? You're also trying to restore the aesthetics. So when you see a dentist that says, I'm a cosmetic dentist, every dentist is a cosmetic dentist because you're supposed to restore the function and the form and you want it to look beautiful. Thank you for the comment about my smile, by the way. With a crown or veneer, I'll refer to a front tooth. With a crown, you remove more tooth structure, probably because maybe you had a big cavity or you had to have a root canal on that tooth. So there's not a whole lot of tooth structure left. So you're trying to restore the function. So you cover that tooth with a crown. Typically you get veneers when you want a cosmetic. So you don't really have a really big cavity, but you're trying to make it more beautiful. So those Hollywood smiles that you see, it's either edited or a lot of times they're veneers. Some people opt to get veneers over braces to straighten their teeth. The downside, now I guess I can answer your question this way. The downside to getting a veneer as opposed to like braces or something like that would be you have to take a portion of the teeth of the tooth away. You know, once you take that portion of the tooth away, you can never grow it back. If somebody can figure out how to grow back enamel, which is the outer surface of your tooth, you'll be a millionaire, a quadrillionaire, if that's a word. But that's going to be your difference. So the veneers and the crown are in a similar category, but with a crown, you remove more tooth structure, and a veneer, you remove less. More than likely it's for a cosmetic procedure or to make it look pretty. I don't have veneers.
All right, thank you. Perhaps related to what you're talking about, someone asked a question about they brush. What about someone that brushes and flosses? They're diabetic and they still have periodontal disease.
It's a very good point. I'm gonna always defer you to speaking to your dentist because there could be some other things going on. But diabetes does predispose you to periodontal disease. Dr. Thomas, are you back yet?
I think so. I'm not sure. Can
If
you
you talk
hear
really
me?
fast, then I think we could get it.
Oh, okay. Well, how is this? Is it getting through at all?
Yeah, talk, go.
Oh, okay. I'll try. I promise you, I'm going to have a faster CPU next time. I promise you that. But yes, what you said is true, and you cannot. Well, you can mitigate the effects of diabetes by keeping your A1C as low as possible. And A1C, of course, measures your sugar level over the period of 90 days, 3 months. Did everyone get that? And you may require more frequent visits to your dentist as well.
Okay, thank you very much.
Did that
Appreciate it.
come through?
Yes, I think so. So thank you very much. So diabetics are predisposed.
Did that come through?
Yes, I believe.
Periodontal disease, yes.
Yeah. So the diabetics are predisposed to that.
Did that come through?
Yes. Have to watch your A1C, especially as a diabetic. That'll perhaps help the situation. But the most important part, as Dr. Free said, is make sure you consult with your dentist because everyone has a different situation.
Yeah.
Here's another one that I'm sure we're going to have to refer back to the dentist, but in general, someone asked, do you recommend bridge or implants to replace a missing tooth?
So let me finish with the perio and diabetes. So what tends to happen is patients with diabetes or diabetic patients are more likely to get infections. So that's on your foot, that's on your hand. That does not exclude your mouth. So remember those germs that are in your mouth that are producing those toxins. What happens is if you don't remove them, flossing, brushing, the toxins are more likely to cause an infection, and therefore you end up with periodontal disease. So you're more predisposed to that. Marvin, the question about bridge versus implant, is that what it is?
Yes.
Okay.
So do you recommend bridge or implants to replace a missing tooth?
So prefacing again, you're right, Marvin. So depending on the situation, it depends on what's happening in your mouth. And if you have these questions and your dentist is suggesting one over the other, I'm going to ask that you tell them that you don't understand. Because the fact that you're asking, it shows me that you're not sure what to get. And if you don't trust your dentist, get a second opinion, right? Because you want to trust your provider. The difference is an implant, typically you're replacing just one tooth. So if you have two teeth and you're missing one tooth in the middle, you can get an implant, something is implanted in your bone, and then you get a crown on top of that implant. So now you have three teeth. With a bridge, nothing goes into the bone. You have two teeth, you have to shave. It's a bridge, literally sounds like what it is. A bridge, like how you cross over a bridge when you're driving. You have the anchor here, and the other, at the end of the bridge, you have the other anchor, and then you have something in the middle, right? The bridge that attaches. It's just like that with teeth. You have one tooth here, and the missing tooth you actually put, we call it a pontic, but it's like a floating tooth. So nothing goes in the bone. It's a floating tooth that sits in between the two, but you have to shave down the tooth in front of it, and you have to shave down the tooth in front of it. And now you have your bridge. You have the anchor, and the part in the middle. So it looks just like a bridge that you cross over water, but instead it's in your mouth.
All right, thank you very much for that.
Was that helpful, Marvin?
Yes, I think that answered the question.
Okay.
So we do have another question. Does oral bacteria affect pregnancy? And I'm assuming the question doesn't mean, are you likely to get pregnant if you have oral bacteria? But I'm assuming the question means if you are pregnant, does it have any adverse impact on your pregnancy?
Dr. Thomas, you want to take a shot again? Go fast.
I can try. How much of the last one were you able to hear?
Yeah, we got it good.
By the way, I am also responding in chat. You can let me know if you're okay. No, you go ahead, Dr. Fraser. I think your connection is much better. I apologize.
And by the way, Doc, I don't see anything from you in chat. So make sure, unless you may be sending it directly to Trudy. If that's the case, that's fine.
So couple things. They affect each other. So,
Okay.
so when you're pregnant, you have hormonal changes, and the hormonal changes can cause an increase in inflammation in your gums. So you're more likely, you don't always have to get it, but you're more likely to develop gingivitis. Is that me or is that someone else?
I think, Dr. Thomas, if you would put your phone on mute, I think we're getting the feedback because I keep seeing your picture popping up. So Dr. Thomas, if you would just mute your phone, we appreciate it.
Okay, so when you're pregnant, you have an increase in hormones. So when you have that hormonal increase, it affects your gums and you're more likely to get what we call gingivitis. So itis is inflammation. So anytime you see the word itis, it means something is inflamed. And in this case, the word prior to itis is gingivitis. So it's the inflammation of your gums. The other thing is when you have periodontitis, or that gum disease, you're more like, it actually has a correlation to pregnancy because you're likely to get what we call preeclampsia. So that's when you have hypertension that's related to your pregnancy, or sometimes the babies are born with a low birth weight, and having periodontitis when you're pregnant can actually cause a premature birth in the baby. So they actually affect each other. So it's super duper important. Even though you're pregnant, you want to be at home, you don't really want to go to the dentist, you more so want to focus on the baby and go to the OB. It's really important that you keep your hygiene together because they're what we call adversely affected, meaning one thing can negatively affect the other one.
All right, thank you very much. Thanks for the explanation. I always was told the itis was something else. So thanks for that. I appreciate that.
The itis is inflammation of something else.
Don't worry, I'll explain it to you later. So we have another question. Are postmenopausal women more prone to getting cavities?
Let me see what Dr. Thomas says. Postmenopausal. I will say this. Let me take a stab at this question. So I'll preface my answer with, I work with children, kids ages 1 to 18. But if I were to postulate to answer that question, anytime you have hormonal changes, you're likely to have periodontitis or gingivitis. It can affect your gums. I wouldn't say you're likely to get cavities unless you're taking a lot of medications that could cause dry mouth. So when the oral cavity or the mouth is dry, you can have a low pH in your mouth, and anything with a low pH makes it more acidic. So then you'd be more susceptible. I'm not going to say that a lot of postmenopausal women are taking more medications, but if you were, I could see a correlation with the amount of medication that you're taking, especially if it causes dry mouth.
All right, thank you. Dr. Thomas says in the chat, clearance from your physician may be necessary to prevent the inadvertent transfer of bacteria to your heart valves if you are susceptible. So I'm assuming that means for any major dental work that you're going to have. Very good. All right.
That
So
is in relation to that question about dental bacteria affecting the heart. If you
okay.
have predisposed heart conditions, you get clearance from your doctor because sometimes you have to take an antibiotic before you get treated by a dentist.
Got it. All right. Thank you very much. That's very instructive. So Dr. Freeze, you're a pediatric dentist. So there's something that, ages ago when we had young children, we were instructed about. Talk to us about parents that put their babies down with bottles in their mouths. What's the problem with that?
Marvin, you're a very intelligent young man.
I tell myself that all the time.
Believe it. Speak life into yourself. So I was going back and forth whether or not I was going to lecture about it. So I'm glad you answered that question. So back in the day, back in your time, Marvin, it was called baby bottle cavities. Now it's called early childhood cavities. Let me start my statement by saying breast milk does not cause cavities. When kids start to breastfeed and they're still, so they have a mouthful of teeth or even any tooth, one tooth, and they're doing both breastfeeding and eating food or drinking milk that's not produced by the mom, the breast milk now serves as a glue, right? So the glue is on the tooth, everything that they eat gets stuck to the glue, and then they start to get cavities. Okay, what happens is there's something in the milk or in the juice, which I say this, I'll preface my statement by saying this. My patients that don't get juice, they don't get cavities. I mean, you guys saw how much sugar, how much Dr. Thomas called it sucrose. You see how much sugar is, added sugar is in juice. The apple juice, the grape juice, all those juices, unless it's freshly squeezed or made from home, like you're blending up a smoothie, it has that added sugar. This stuff really breaks down the tooth, kind of like what I was explaining before. So the milk has lactose, which is a sugar. So it's not as harmful as the sucrose, which is the juice, but it is harmful. It sticks to the teeth. And then the bacteria that we referred to earlier eats the sugar, right? And produces an acid. That acid burns holes in the teeth. Now with the babies, you'll see the cavities in the front teeth because a lot of times they're laying back and the milk pools on those teeth. So the teeth are literally bathing in that milky, sugary substance all night. Please do not add sugar. Don't add this stuff to the milk to get the baby to drink it. The other thing I want to do is after brushing the baby's teeth at night, only give them water. If the baby will cry, they'll get used to it the same way they got used to everything else. If they want to drink something at night, please, please, please give them water. And if you're in the process of stopping breastfeeding, you want to have a wet cloth by the bed at night, just wipe off their teeth. This is the least you can do because you're not going to get up to brush it again. I think that's unrealistic, but at least wipe off the teeth so that that milk that's serving as a glue is not just sitting on the teeth and then the germs are eating that and producing an acid. I also say this, I don't think I have the pamphlet, but I got a question in the chat. If the child is under 3, you want to use just a smear. You can use a fluoride toothpaste, but if you want to be conservative, you can use a fluoridated toothpaste, but use a smear of toothpaste and brush your teeth with a soft bristle toothbrush. But if they're 3 and above, you can switch to a pea size amount, those little small green peas size amount to brush your teeth with that.
Okay, thank you very much. So speaking of brushing, long time ago, we used to think that the best way to get clean teeth is to get the hardest bristles you could possibly get. What do you think about that, Dr. Freeze?
Are you playing devil's advocate?
Yes, I am.
So the hard toothbrush will, I mean, they will get your teeth clean, but we have to think about our gums. When we brush, the bristles touch the gums as well. And what will happen is the gums will start to move away from that hard surface. So you want to make sure that you're brushing in circles because the gums around the tooth is scaffolded, right? So you want to brush in circles along the line of the gums, not like this, because you'll find that the gums will start to move down. Okay, so you want to use a soft bristle toothbrush because those nice delicate gums don't want hard surfaces and it'll start to move away from it, which they'll probably they'll call it toothbrush abrasion, but it can show up like gingivitis. It'll cause the gums to move away.
All right, thank you very much. Dr. Thomas, looks like your twin has joined us. So maybe
Yes.
one of you is able to talk.
Okay, let me get out of this other one. As a matter of fact, I
All right.
went to my cell phone instead.
All right, good choice, good choice. So while we're waiting on you to get that set up, one more question. We have this in the chat, and Trudy, you may have seen that. You mentioned you had a question in the chat. This one question says that they have close to every crown in their mouth, they have cavities in spite of flossing, brushing, and dental visits every 6 months. So do crowns trap food and predispose us to cavities?
Dr.
Now
Thomas?
that's a good question. However, the one factor that we aren't able to evaluate in the simple question there is what actually are their oral hygiene practices? So we can't answer that per se. And yes, there is the technical excellence in which the crowns or bridges were placed. That does have a factor, that does matter. However, oral hygiene generally affects more things than other things. However, one other factor to note is that people with crowns, we don't know if they're on the posterior or anterior teeth. So I'm not sure we could answer that, per se. There are some genetic factors. I have come across, patients that simply do not get cavities. I don't care how they take care of their teeth. And there are others that are predisposed, no matter what they do, it seems. For those patients, we recommend an enhanced version of fluoridation of fluoride treatments. We have something that's called like Prevident 5000 or similar name, in which usually if we can identify what's going on with that patient, we will institute this fluoride therapy. So
Okay.
I hope that's good information for you.
Thank you very much. I believe so. So let me ask you a question. We have a lot of people that are really health conscious on this call, and a lot of people drink water, and every morning they'll squeeze lemon juice in it. But Dr. Freeze was saying that acid actually breaks down the structure of the tooth. So help us out here. Should we drink this lemon water every day, or is it a problem, or is there a way to drink it? What do you think?
That's a good question. I like that question because my mom does it. Is she still on here? So what I would recommend, lemon water is good, right, for your body. It's not my favorite for the teeth, but there's a way to get around doing it. What I recommend is drinking the lemon water with a straw, so it shifts the liquid away from your teeth. And then what you can do afterwards is drink regular water. What's happening here is that word pH, you have acids and bases, right? So you want to have a neutral pH, right? So what
Correct.
regular water will do is bring your what the lemon water does, it changes the pH. I think lemon water is actually very, very, is it basic? Lemon, citric acid? No, it's acidic, citric acid. It has citric acid.
When consumed, citric acid is, it's acidic. It's a pH of probably less than 4. It's probably around 2 or 3 or so. However, in the in the presence of salivary amylase, it does tend to be neutralized. The most damaging acid is usually metabolic acid. That doesn't mean that you can't get any damage from foods like lemons, pineapples, things of that nature. So if it's done in excess, yes, you will definitely get some destruction.
Mhm. So
I can see acid destruction more clearly in patients that are what we call bulimic, and they regurgitate, and this acid comes up from the stomach, and you can see erosion on the we call them lingual surfaces, but the surfaces of the teeth that are inward toward the mouth. So by far, the acids in our gut are much stronger than acids that are consumed in fruits. But they can be consumed in moderation, just like anything else.
So to answer your question, Melvin, I'm sorry, I got caught up. I need to do some more research on that lemon water thing. But I think that's a very good way to do it. Drink the lemon water with a straw and then neutralize that pH with water. Dr. Thomas was talking about just the effects of acid on the teeth when people eat and then throw up the food, for layman's term. That acid from the stomach is the hydrochloric acid is super acidic, and it burns through the teeth. With the lemons though, when people literally sit there and suck on lemons, that's way worse than drinking lemon water. That is a no-no. That is you are guaranteed to get cavities by sucking on lemons. And because of that, I'm gonna say to neutralize that lemon water with regular water and to drink it with a straw.
Okay, thank you.
Very good.
So to go along with your comments, Dr. Thomas, about bulimia, isn't there also a connection between GERD and tooth decay?
Yes, it works the same way. So
Yes.
GERD is gastric esophageal reflux disease, and it's
Yes.
an involuntary, fancy word, regurgitation. It's an involuntary action where the stomach contents come back up and they end up in the mouth. So the acid from the stomach really burns holes in the teeth, and it weakens the enamel, which is the outer surface of the teeth. And when your protection, which is your enamel, is weak, then you're likely to get cavities.
Interesting. So tell us, so there's a lot of money going into advertising these teeth whitening systems. Is there any danger with those things that we see advertised that they're trying to get us to buy?
Well, there are different whitening agents. Most of what you see commercially, I would say, is driven by the market, by the fact that people, want to feel that they're doing something to enhance themselves aesthetically. But they usually, the do-it-yourself type things, they kind of circumvent the hygiene aspects, and you can actually make things worse by using those products, but you're not keeping the plaque off the teeth basically. Now, do they work? Some of them do work, but they do not have the effect of one that you would receive in your dental office, because there are many factors that would be considered before even going into a bleaching situation.
Okay.
But if you want any further, like there's what we call carbamide peroxide, and there's hydrogen peroxide. There's different concentrations of hydrogen peroxide and carbamide peroxide. For example, there's a 12%, there's a 16%, there's a 22%, and it just depends on what's in the kit and how it's done. The faster it's done, I would say, the more likely you're to get problems with sensitivity in the teeth, and which can be quite a problem, can be very debilitating as well.
Okay, thank you very much. Got a question in the chat.
Marvin, can I respond?
Yes. Yeah, oh, I'm sorry, go right ahead.
I work with kids, so you see how eloquent Dr. Thomas is?
Uh-huh.
I work with kids, so I'm forced to just kind of make
Make
things
it really simple.
like just really simple.
Yes.
And Dr. Thomas, I understand exactly what you're saying, but I'm not quite as verbose. And
That's wonderful.
so I'll respond to that as well by saying, one, before you bleach, before you straighten, that includes Smile Direct Club. Lord Jesus, help me, please. You don't go to a you don't go to Sally up the street to get your foot surgery. So please don't go to Smile Direct Club, Straight Smile, anything that wants you to do mail-in straighteners or mail-in whitenings, or the whitenings in the mall or the whitenings in the store to get these stuff done. Yeah, right. You don't do it with your overall health. You don't do it with your physical health. Please don't do it with your dental health. What we're finding is that these individuals aren't trained. We go to dental school for 4 years minimum. I go
That's
to
right.
residency for 2 years after that to do what I'm doing. Dr. Thomas has been practicing for years. There's a reason why it requires so much training, that any
right.
Tom, Jack, and Harry can't just pop up and do it, because they don't take your own health and they don't take what you present with into consideration. And what you don't know is they have you sign these disclaimers so that you
Yeah.
can't sue them. We're finding people coming back years later with issues because they went to the mom and pop shop up the street, right?
Exactly.
So in terms of the whitening, I would first recommend that you go and consult a dentist before you start whitening, because you start whitening your teeth that have cavities, you're gonna
That's
get
right.
issues. The number one side effect of whitening is sensitivity,
That's right.
right? So if you're going to whiten your teeth and you've already gotten a dental clearance from your dentist, and more than likely your dentist is going to say that. For kids, one, you want to make sure that they have permanent dentition. Please don't do the Crest white strips on your child because you see that the permanent teeth look a little bit more yellow than the baby teeth. Wait until they're 12, 13, all their teeth are in. If you want to try Crest white strips, it has a lower concentration, like what Dr. Thomas was referring to.
Mhm.
You can try that at home. And also use Sensodyne toothpaste. Start it 2 weeks before you start the whitening, because then you're less likely to get the sensitivity. The other thing with the whitening, I forgot what I was going to say, Dr. Thomas.
You're doing a pretty good job.
Yeah. Oh, this is what I was going to say. The at-home whitening kits, like Dr. Thomas was saying, has a lower concentration of, for lack of a better word, bleach. It has a less, it's less potent than the one you get in the dental office, intentionally, because it's at home. Do not do Smile Direct Club. Do not do any of those. I don't have any suggestions on how to do it. It's a bad idea. Consult your dentist and get it done that way.
And let me add also that your dentist is going to consider multiple factors before, whitening your teeth. That whitening your teeth, that should be like your reward for, good oral hygiene. You're doing well, and you have managed your cavities. You have no periodontal disease, and so now you're going to reward yourself with whitening, to do something aesthetic. So that's when those things should be considered. The dentist will make a carrier that's molded directly to your teeth, unless the bleaching agent is required to actually accomplish the whitening, and it's monitored. So if anything is, going, left, you will know it because you're being monitored.
Mm-hmm.
So that's a very good question, because there are any number of enterprises that are capitalizing off of people's ignorance. Yeah. Ignorance is not bliss.
Not all the time. I know what I was going to say, Dr. Thomas.
Yes.
Our teeth are supposed to be the color, or excuse me, your teeth are likely to be the color of the whitening of your eyes. So the darker our hues, the darker our teeth, right? So the bleach Hollywood chiclet Steve Harvey smile typically is not real, and that's unfortunately what we're comparing ourselves to. But the other thing you can do, Dr. Thomas made reference to it, is ensuring that your hygiene is good, because when the food and the germs are sticking on your teeth, the plaque, which is the leftover from what you ate, hardens if it's not brushed off, and that tends to darken your teeth because it starts to get staining. And then what you can do to reduce your likeliness of getting stains is drink dark drinks or eat dark foods in moderation, and drink dark drinks with straws. So that shifts the color away from your teeth.
One other thing you might want to know about whitening your teeth. There are some people have thinner enamel. So the dentin shows through this thin layer of enamel. I had like Dr. Fraser was saying, generally speaking, your teeth usually are matched to your complexion by and large, for the most part. That's why dark complected people are not actually supposed to have bright teeth. But there are some people, some individuals who may be fair skinned, but they have conditions of the enamel. I won't say any big words this time, but that exposes the inner layer, which is yellow. It's more yellow than the outer surface. So in those situations, you can still whiten your teeth somewhat, but you're likely to do more damage if it's not being done by a professional.
All right, very good. By the way, we've had a couple of questions in the chat about where the both of you practice. So if you want to put your practice information in the chat for everyone, then they'll be able to pick that up. One other question in here. Let's, for those who maybe have not taken good care of their teeth during their lifetimes, or they have some other problem that causes them to have dentures, should you remove dentures every night is the question.
That's an excellent question. I've done many dentures, and the answer to that is an unresoundingly yes. You should always remove your dentures. There's a condition. Well, okay, once again, I'll try to make it really simple. Germs like moist, dark places. Your dentures, and in particularly your upper denture, is held in place by suction to your palate usually. But when you occlude your palate with a denture, you create this moist, dark place. And you will get, most notably, you'll get Candida albicans and other types of infections up there. So you want to give your mouth a chance to rest and breathe and rejuvenate, just like your body. You wouldn't, well, certain types of restrictive underwear, you wouldn't want to keep that on all night. Certain type of, everyone needs to get loose and allow their cells to regenerate. So yes, you should remove the dentures, place them, always keep them moist, because if you do not, there will be a hardening of the plaque onto the dentures, just like onto your teeth, and they will soon become very unsightly, very difficult to clean.
All right, very good, thank you. So those are all the questions we have in the chat. Do we have anyone else that wants to ask a question live? All right.
I think someone asked me for a periodontist. I'm going to put it in the chat.
Okay, thank you.
What was that?
Someone asked about a recommendation for
periodontist?
periodontist.
Go ahead, Marvin.
Oh, I see. Okay.
No, I think she was asking you.
Oh, do I have a recommendation for a periodontist?
Yeah.
Well, where do the individuals live? I would certainly recommend. I like to recommend that people get word of mouth referrals from people you know in your region or locale, and also you can go to the American Dental Association website, and they will make a recommendation. This question becomes a little bit more tedious because individuals have various insurance companies of which the providers may be in or out of network, et cetera. But if you have a friend or someone that's been to someone, I would recommend that first. Dr. Fraser, did you want to add to that?
Well, I recommend, so for a periodontist, I don't have one in Decatur. They said Decatur and Gwinnett, but I do have quite a few general dentists that I could recommend. One being Calm Dentistry, and they're in Snellville. And it's, excuse me, Grayson, Georgia. The name of the practice is Calm Dentistry. My classmate Carla and her husband Chris are the dentists there. They're phenomenal.
Oh, awesome.
You could tell them Dr. Fraser sent you.
All right, thank you very much.
I gave a generic answer because I know people are watching from all over the U.S. and other places.
Yeah, the person asked for Decatur and Gwinnett for perio.
Oh, I didn't see that. Okay.
You know, it's a good idea. You can Google the person, Google periodontist, and look at Google reviews. I mean, for any business, that's what I do. But I try to be objective with Google reviews because sometimes people are just bitter. So when they say objective things, I mean, if you have 10 good reviews and 2 bitter ones, I ignore them. But if you have 9 terrible reviews and 1 good one, then I would be concerned. But check out Google reviews.
That's a choice. And there's 1-800-DENTIST. There's any number of.
Dr.
But
Thomas, are you taking new patients?
No, I'm in a semi-retired status right now.
Good for you.
And I'm doing more humanitarian things, and I'm working with adolescents mostly. So, but I am from time to time associated with practices. Let's see, maybe I can put something in the chat for you.
Sounds good.
Private doctors.
All right, thank you very much. Appreciate that. Well, if there are no other questions, we'll come to the end. And thank you, Dr. Thomas. Appreciate the pun about finding a dentist word of mouth.